We've all heard of varicose veins, but do you know what causes them or just how serious of a problem that they can be? Dr. Dale Payne, cardiovascular surgeon with Arizona Vein and Laser Institute, is here to tell us. Good to see you, Dr. Payne.
Nice, Gina. Nice to be here.
So tell us first, what exactly are varicose veins?
Varicose veins are the type of veins that people recognize as either spider veins or kind of like bubble-like veins that occur on the legs, generally on the legs. They can occur in other places like the arms and all, but mainly we deal with the varicose veins of the legs.
All right, so how do people get them?
Well, Gina, it's mainly in the genes.
Oh, darn.
And 90% of people who have these have some relative that also has them. But they can also occur in automobile accidents or some type of trauma, lifting too heavy weights. That they can worsen with childbirth, and the type of work we do is standing all the time.
So how do you diagnose them to figure out what type of vein they are and how serious they are?
Well, if people recognize that they have pain in their legs, and they also notice these blue veins in their legs, what we need to do is do an ultrasound to see what's causing them. The veins that cause the varicose veins on the outside of the leg originate from veins that are just a little deeper. I like to compare it to like a volcano, where pressure underneath comes up and forms the veins that we see on the surface.
Okay.
And the way we treat those veins is by taking care of the underlying cause. There are a few people that just have purely spider veins that can be treated with injection therapy or external laser, but we'd like to know what the cause of the veins that are causing the problems.
And can that be fairly serious?
If like a lot of guys let it go until it gets very serious, and so those can result in ulcerations around the ankles, kind of what's called woody induration, where the skin itself becomes hard as wood.
Wow.
And bleeding from ulcers.
All right, so how do you know the difference between the basic kind of varicose problems or the arterial problems?
Well, you know, we treat both now at the clinic. We treat both arterial and venous diseases at our clinics. But I'm primarily here to talk about venous diseases. Arterial diseases is something that we relate to an occluded or blocked artery that goes to the leg, and that's kind of different symptoms related to something called claudication, which is pain when you walk. Varicose veins is kind of an aching pain, sometimes itchy. People also describe restless leg syndrome, and just pain in the veins that they can see on the surface.
All right, let's talk again about the treatment of those and how you treat them.
Once we get an ultrasound and we can diagnose what veins are involved with the problems that we see on the surface, we can, through a small needle on a local anesthesia, insert a small fiber, little optic fiber, that goes into the vein, and we direct it up under ultrasound guidance to a point below the main deep system. And under more local anesthesia, we turn the laser on, pull the laser back very slowly, about 2 millimeters a second, and we burn that vein that's causing the problem. That vein collapses, and once it's put under compression with stockings, that vein will heal flat.
And you offer a free consultation, right?
Yes, we do.
So tell me a little bit about what people can expect there.
Well, the free consultation is when they come in, they see a physician. We ask them questions about their history, whether this may be related to their family members, or how it runs in the family and what other medical problems they have. And if they need an ultrasound, we recommend that to them.
All right, perfect. Thank you so much for being here today, Dr. Payne. And if you would like more information on Vein Med Solutions, visit them online, ArizonaVeinandLaser.com.